Welcome to the village. Thank you, Philomena, for joining me next. So Philomena is a nurse, a registered nurse, and she works here in St. Teresa Hospital in Zara for the Tuberculosis Clinic.
Yes, I'm Philomena Richard Minisane, and I've been here since 2001 on the 1st of August. That is the time I resumed St. Teresa Zara Hospital dealing with the TB.
So it was just your third year anniversary of working at St. Teresa Hospital. So 3 years you've been here.
The years?
3 years.
3.
Yeah. You said 2021?
Yes, 2021 on the 1st of August.
Okay. And you were assigned to work in the Tuberculosis Clinic.
Yeah, that I was assigned to work as in charge of tuberculosis in 2012, in August also.
Oh, 2012 you've been
Yes,
here since.
I was assigned to be a TB in charge, to work with the TB.
Oh, so you've been here for 12 years, not 3 years.
Not 3 years.
Oh, you've
It
been
is
here.
almost 20 something years. Because I started work here in 2001.
Oh,
Yeah.
2001.
Yes.
You've been at St. Teresa Hospital.
Yeah.
2001.
2001 is when I was employed to work in the TB program here.
Well, that is impressive. That's a very long time.
Yeah. So in 2012 is when I was assigned to start TB program.
So 2001 is when you started in St. Teresa.
Yes.
And 2012 is when you started
To be in charge for TB.
Where did you come from? Where did you grow up? How did you get into nursing?
From home.
Yeah.
I came from Nandi.
Okay.
I was born in Nandi, and I came to start work in Yambio State Hospital is when I was sent to Maridi for training for 3 years nursing. And it was in 1981 is when I started to work, to train, under training. Then for 4 years I was already a nurse, and I started to work. We went for civil war to Congo. Also, I was working as a nurse, even practicing midwife. So we were again destroyed by the SPLA from there. Then we came back to Nzara. Then from Zara here, I started to work here in 2001.
Okay.
On the 1st of August.
Because of the Sudan civil war, you had to leave the country.
Yes.
You left there with your family, or?
Yeah, I was married.
Okay.
Since 1983. We went as a refugees with the same man, and up to now we are with the same man.
Okay.
Yes.
Good. That's good. That's nice. That's good news.
Yes.
All of these things are so rare to hear. And so you went there, and then from there you were working.
Yes.
And you came back here when things became more settled down and more safe. But still there was war here.
Yeah, there was war. Even when I joined the work here, there was still war. The peace came when we were here in 2005.
Okay, so from 2001 to 2005,
that's when there was some peace, comprehensive peace agreement in South Sudan.
Okay.
Yeah, in Sudan, let me say. Then the separation was later.
Yeah.
As you know, in 2009. It was 2009.
2009 is when the separation happened.
Yeah. I cannot remember now. But it was,
a lot.
very many years.
Yeah.
Maybe you are not even born.
No, I was born the year you started your nursing school, I think you said. When you had to leave for the Civil War, it was the goal that you would come back when things were a little more like safer, I guess. And so you and your husband decided that you would come back here.
Yeah.
What made you then decide to come to Nzara?
Because my husband was a policeman and he was a soldier. So he feared to go to his place where he was born because he would be killed. So he came to Nzara because his mother was here. So we came here because of that. When we reached here, we have to look for what can help us.
Yes.
Because really we were chased away from Congo. We came naked without anything. So we have to try to do what to do, how we can live. So that's why he was searching also for work. Then for me, also I started to apply to Saint Teresa. And that's when I was interviewed. Then I was employed to work with this program. It was not very big like this, but it has extended and expanded just during my present.
23 years of being in this hospital. You must
should
have...
be 23 years, yes.
Yes.
Yeah.
So there's so many things I can talk to you about. Besides the TB program, the hospital, your life, and your feelings and thoughts. Like your husband was a police officer, and also in the military. So not
He's
in the
a
military,
police.
just a police officer.
Yes.
So being involved so directly with all the unrest, there must have been times that you were fearing even for the life of both of you. I mean, you had to flee the country, right? When you left, you had no choice. You had to leave quickly. When you left Sudan and went as a refugee.
Yeah, we went as refugees to Congo. Even we were working there with the refugees there as a nurse.
Okay.
Even helping the mothers, delivering mothers there. I was there working. Then SPLA came to Congo and they destroyed us, made us to come back by force, whether we like it or not. So we have to come. We start coming, worried that we are, because there was no any peace. So we were coming as fearing where to stay, what to do in the future. Meanwhile, my husband was a police. Maybe they are going to kill him. We were coming just fearing. So we were just praying God what to do. So we came up to Yambio. From Yambio, we came to Nzara. We stayed very far from the town with his mother. Then that's when we started to look for what to do. We did not even, nobody helped us, like giving us something to do, to eat or to cover with, nothing. So only the civilians and the covers that we touched when we were running, because we were coming forcefully, by force. Even some who did not want to come were killed. So that's when we started looking for work, what to do. And that's why I was here. I applied to the sisters, compound sisters. They employed me to be a nurse. Yeah. And this program started, of TB. It started before I was here in 1994. And they were treating patients, TB patients, very many. Let me say the whole Western Equatorial, South Sudan was being treated here. Any tribe, Dinka, what, they were all coming, even from Congo. And this building was for TB patients, continuation treatment. They could start there initially, then they transferred them to this building now, which is a art clinic. From there, it start to develop. Then we started together with the sisters for the disease HIV. We were seeing patients dying, TB with the HIV, they were dying. So the sisters struggled by all means to get HIV treatment closer to Nzara. So that's when they stopped admitting patients here. They constructed a room there for health clinic. It was there, this is a medical ward. It was an office. Then from there, it was attached, there's a pediatric attached to it because there was no any treatment center here completely, only in Zara. Then as it was expanded, a lot of patients were receiving different cases from TB, Brule ulcer, HIV, leprosy, to general cases. So it was not easy. So they started to expand this program here. That's when they found that there is no place where the children or adults can be admitted. They transferred health clinic here, then opened that one as a ward.
Okay.
Yeah, I was here.
Yeah. You saw all of it.
Yes. So from there, that's when that sister who was doing this, she left. Then another one came, Sister Sarah. She also did her best. She went. We were still dealing with the TB. I was before as a pharmacy in charge.
Okay.
Yeah, then
what
I was
Night is doing, like that job?
yeah, like dispensing.
Okay.
Yeah, I was in the dispensing room as in charge. Very big. It was we could request from the store, then the departments would request from us. It was so. Then I was transferred from pharmacy to TB department in 2012. Is when I resumed doing TB, and I up to now I'm still working with TB. Yeah. So the only challenge is for me is I feel very happy. I thank you very much for what you have done to know my story, to know who I am as you are going. You should know who I am.
Yeah.
Among the younger ones as an adult staff in this hospital. Thank you very much. To know also my challenges, my condition, my situation. The only challenge is the issue of salary is a problem. Now TB could have been closed. Since when Sister Sarah went and the Laura came in, maybe the program for TB was not working because we were working with the code aid. He was the one helping us. Code aid it could not work. So we were there hanging what to do with TB until God brought AAA, Arcangelo Ali Association, in 2020. Then they stepped in 2021 in St. Teresa here. So they are now helping us really to give us drugs for the patients. And we are treating multi-drug resistant TB cases because of the AAA. But the salary is a problem in this program. But the AAA, they are supporting. They are giving a motivation of something to motivate us. As like an incentive. This is what they are doing to us. And this is what is now helping those of us working with TB. We are not very many. It's only me. Then AAA came in and she too employed one clinician and one lab technician. We are three under AAA. Then just this year in April is when he got one person to be tracing patients from outside, those who are not who are lost to follow up. The situation is the only thing is salary, and the things which was to be done for the TB patient is stopped. They are telling us it is by the government, because when we were here with the TB program, the TB patients were very happy. They could eat from here. They could give them washing soaps, some uniforms, slippers. They were very happy, and they could give them some nutritious food. In they were even because they could start the initial phase from 0 day to 6 months. They could complete the whole months here, 6 months. So there was a school for them. Like the younger ones, even the adult like us, you want to get something like school. There was a teacher who was teaching TB patients. So they were very happy. Reaching 2018 there, everything stopped. Maybe because of the program. Those who were with the program, they were not there, the donors. Maybe they stopped. Now, AAA are those ones now helping us, helping TB program. So this is what is I can tell you about myself in the hospital. Yeah, about me personally. You want it?
Yes. I can ask you one or two about the program, and then I want about you too.
Okay.
So, you feel like there was more donors for the tuberculosis program. Now there's less donor money going towards the program. That's the problem with not being able to treat the patients as much as you used to, or you've seen like they were getting schooling and staying here, and now what happens with them?
What I have heard is the government is stopped that they could not be admitted. Because of what I don't know, because we were admitting them. TB is a very difficult disease and chronic, and the treatment is long.
Yeah.
So they cannot manage. That's why the sisters made them to complete 6 months. When you become cured, then you are discharged, declared cured. You may not spread the disease again in the community. But the government, I don't know who was that, WHO or who, I don't know. I just heard there is no need of admitting TB patients again because they started spreading the disease from home. And when they are admitted, the disease is already spread with the relative at home, the family or the friends. This is what they were telling us, that there is no need of keeping them in the hospital. When the patient is already positive, give the treatment and give adherence counseling, and advise the patient to take the treatment accordingly with the treatment supporter, like a family or the community supporter.
So the thought was that they've already spread it in the communities, so they should stay at home. If they come to the hospital, it will not reduce the spread because they've already spread it. Because tuberculosis is airborne, it's very, very easy to spread. Right?
Yes, it is easy to spread.
Yeah.
Tuberculosis is very dangerous.
Yeah.
It is spread from person to person by droplet through hair.
Yeah.
When the patient cough, sneeze, then the bacilli hang just in the hair. Yeah. The one close to the infected person can inhale the disease.
Is there also some kind of education and awareness happening in the community, or is it just people, do they come forth when they have symptoms, or they just stay home and they don't come forth and seek treatment?
Yeah, there should be some health education in the community, but the only thing is the challenge is there. We can go to the community, but we are not because of the condition. the situation of transportation.
So it's difficult for
Yeah.
our hospital to go around and.
Yeah.
Do you think that's something that's really needed? Is that maybe we need some funding for some resources to go and start to educate about tuberculosis?
Yes. We are lacking the one who can help us.
Yeah.
But as we Triple A is helping us, this is all, but they are not covering everything.
Yeah.
Yeah. Transport, like tools, like these posters.
Yeah.
It is difficult for him. He also begged the single man here, which was sent by Triple A. It is difficult for him to get everything. That is the problem. We have a problem really with the TB. We don't trace. We don't trace them because of the transport.
Yeah.
That's the main problem. And the security to go very far. We could not make it.
So it's not a very well controlled issue here, is it? Since you've been here in this hospital, have you seen an improvement overall in the number of cases or the management available for tuberculosis?
Yes, there are a number now this year we have received 50 patients positive cases that we are dealing with, aside from the because we have this mere negative extra pulmonary, but the positive case which is spreading the disease, we got 50 cases this year, and still we are getting them.
Are many of them children?
The 50 we have 3 children,
Okay.
like the other one who was in the ward,
Yeah.
and the other one who had the meningitis.
Yeah.
And we have another new, a small one of 8 years.
And it's tough because you said they need long time treatment. Isn't it 6 months you have to keep the treatment of 4 different medicines, right?
No, 4 different medicine. No, we adult, we treat them with the 4 combination of drugs according to the body weight daily for 2 months. Then we send them to the lab for conversion. When they become negative, we continue with them. According to WHO, they are telling us although they are negative or positive after 2 months, we continue with the 2 combination of drugs plus vitamin B6 to prevent the side effect of the drugs. Yeah, this is what we do for adult. Same for children, but there is a different. If a child is having tuberculosis, positive or negative, because it is difficult for child to confirm from the children. So we start according to the symptoms and signs we see with the children sometime, or X-ray sometime, but we don't have X-ray. We had X-ray, but got spoiled. That's or unless if we just give a saliva, aspirate from the throat and the test. When it is positive, we start initially with 3 combination of drugs plus 1 makes the total of 4 drugs still initially, plus vitamin B6 according to the body weight of the child for 2 months. Then we continue from 2 months for 4 months. The same like the one of adult, but the drugs are different. They are different with the milligrams.
Okay.
Yeah, the milligram is the one differentiating the one from adults to children because they are according to the body weight.
And that's a lot of drugs to put into a small child's body. I'm sure they'll have their side effects and negative effects too. They're very strong.
Yeah, the children, they have especially the ethambutol, the separate one that we say was separated from the combination. It is the one having a side effect. Sometimes the child, we don't know if the child is developing blindness. We cannot know. That's why it's supposed to be different from the rest. If we are seeing how the child is not able to see, we stop with Tambitol, we continue with the 3 combination of the drugs.
And like you said, that child that was in the HDU in the ward with the TB meningitis, she wasn't improving. Like she's just laying, like her postures, her body, she's not moving anymore. She's not really responding, even though the tuberculosis, the actual microorganism, will be treated with the medicine. Even when it leaves the body, the effects of the tuberculosis on her body will still be there because it's not the pulmonary kind. She had the kind, if the tuberculosis goes into other organs, it can cause permanent damage. So this small child that had it in meningitis, it looks like she's damaged. There's no way to really recover for her.
Yeah, if the TB meningitis is very, very dangerous. It can make the patient vomit.
Yeah.
Even damage the brain, the nerves, even the waist. Now, the mother came the day before yesterday, within this week, last week, to collect the drugs. She told me at least she can eat.
Okay.
She can see, but still there is convulsion.
Yeah.
She's still converting. So we take the duration of drug of meningitis is for 9 months.
Okay.
So we should continue still. But the child will be not normal again, will not be normal.
Yeah.
Because the brain is a long time convulsion.
Yeah.
It's damaged already.
It's very sad, and she was a healthy child before that. So many of tuberculosis patients are healthy, and then they contract tuberculosis. What's the best way for people to prevent? How do we get rid of tuberculosis from this area?
The best way is we give health education to them because they don't know what happens. When they see there are people who very sick like that, they think a different thing.
Yeah.
They say maybe they are bewitched. They go for traditional, especially this meningitis.
Yeah.
It is very dangerous.
Yeah.
Even TB. So I don't know. It needs health education to talk to them so that they could understand what to do with the TB. TB is very dangerous disease, especially the one meningitis and the multi-drug resistant TB.
Yeah.
Yeah, these are the diseases which is very dangerous in TB. But if the patient is only positive with the TB and you come for early treatment, the patient can become cured. It needs you follow what you are told. If the patient is following, really, the patient can become cured completely. And the better one is early treatment, especially for meningitis.
If you waste time going to traditional healers, especially you said there's these cultural thoughts that there's some bewitched or some curse or something put on, and then you go traditionally and it's wasting time.
The patient can die. Especially this kind of patient, you come very late, the patient will even become disabled like the one with meningitis. Mostly, they don't treat accordingly, they just die.
Yeah.
This is the only thing that I've realized, and I've taken a lot of times with the TB.
Yeah.
Yeah.
It's tough because you're around TB patients a lot. Do you wear an N95 or how do you keep yourself safe?
What we were told is we have acquired the TB is in us.
Okay.
But what helps us is our body immunity. If it one time it comes down, that's when they also react.
Okay.
Yeah.
You have like a natural immunity now because of exposure.
Maybe I have a
Your body doesn't care. Your body's been through enough. It doesn't, not scared of tuberculosis.
Now, what do? I have to help my people. If it comes to me also, that is my time. What do I do?
Oh, Philomena. So let's think. Do you think wearing an N95 would be helpful? Is that something you would want to do?
That is a kind of prevention.
Yeah.
Yeah, but when we started, there was nothing that called N95.
Yeah.
We started very new.
Yeah.
Yeah. That's why I'm saying I have TB.
You're
but
fine. Yeah.
they are just dormant there.
Yeah. Yeah.
They will wake one time when my body immunity goes down.
Oh,
Yeah.
well, hopefully not for another 50 years. 100 years. Okay. You have so much more to do, and we can talk about you now. Like you say, the payments, your salaries, do not come on time, or they don't come enough?
Yeah. Our salary, you just imagine what I do think. I said, I don't know, maybe it was my age. It is my age, it is maybe they are thinking that I cannot continue working. I don't know. Because I was given a contract in 2020 that it is a probational period. And it was 2 papers, $200. Up to date, I'm still under probational period. This is my question that I ask myself. For how many years? Probational period.
That's not fair.
That's my question to myself.
Yeah. Who is in charge of your contract and your payment?
Saint Teresa.
Okay. Through CMMB, or is there another donor that?
Previously, those ICAP was the one because I'm with this ART TB patient. I'm with the ART. Those who are supporting ART are those ones also helping me because we are together with TB and HIV.
Okay.
Yeah.
Okay.
We treat patients. When we get TB patients, we screen them for HIV.
Okay.
Same for HIV. When the client is found positive with HIV, should be screened for TB.
Okay.
Because HIV can lower the body immunity, and the TB can continue with the patient. Yeah.
At risk. Yeah, that's, you put yourself at risk. You give so many years, your whole life to this profession and to these patients. And so it should have some appreciation and at least be able to support your family and be paid for the work you do.
This is what I've told you.
Yeah.
This is what they are giving me.
Yeah.
And previously, when we started the work here, there was some motivation that the sisters were doing. They were giving us at least a salt at the end of the contract. Salt.
Wow.
And some piece of soap.
Okay.
And sometimes they give a piece of clothes.
Okay.
Sometimes a bucket.
Okay.
This is what they do. They were doing. But it stopped.
Okay.
Yeah.
The incentives were small household items.
And there was something called 13 months they were giving us. But the salary was small.
Yeah. Yeah.
The salary was not
Very small.
enough. Yeah, they were small, but what was okay is monthly paid. Yeah. They could pay monthly.
Yeah.
Yeah.
Okay.
And this is what they were doing, and they were happy. But now, you are given the 2 papers, and they are saying you are under probational period. For how many years, I don't know.
Yeah.
For how many years, sister, I don't know. And we have children that we are paying to school.
Yeah.
But with this one, you cannot do anything at home. Like doing something like this for the future. We are struggling unless if you don't have many children. That's when you can try. When you get the salary, you get one thing and keep one for the other time. If the delays also, you have a lot of loans. What to do? Everything in the program or the plan that you planned is destroyed because of this delayment of this small salary.
And do you have children you support and you're supporting? And no, we can talk more about your life with this. other things you've seen, your children, your future plans. All about Philomena, your life. Tell me.
I have children that I'm paying to school, like 4. One is almost completing university, but he is a seminarian. He wants to become a priest, so I don't know when is he ending. And this boy, he wants.
You said your child is in university, or
Yeah, there is one in university, and the one is the one very sick in the hospital, the wife of Thomas II.
oh,
Yeah.
oh, that's your child.
Yes,
That is your daughter.
my granddaughter.
Your granddaughter is
Yes.
Sekundo's wife.
Yes.
Wow.
And there is another one.
Okay, then there's another one.
There is another one of 15 years in Iba boarding school.
Boarding school.
Yeah. There are 2 here in primary school. In Zereda, down here.
Okay. Okay. So you have lots of children and grandchildren to
Grandchildren.
support.
I have only one child. I gave birth to one child.
Okay.
Yeah, and he have given birth to children that I'm helping him.
So you have one child, and then the child has children who you're
Yes,
helping.
yeah.
Okay, that's so nice. But you had your child when you came back, or you had your child when you had to leave the country, when you left and came
Yes.
back. It was your husband and your small child.
Yes.
What else do you want for the hospital and for your life, and what else do you want people to know? This is your time, because when I go back, all the people who listen to this want to get to know the people that I met here, and it's best they hear it from you. And this is your time to tell anybody who listens about you and your life, your experiences, the hospital.
Yeah, thank you very much for this very nice question.
Oh, good.
Yeah. For the hospital, let me talk about the hospital. This hospital is helping us. It is really helping the community, plus those of us who are working in the hospital. So I think I don't want this hospital to discontinue. We need the help to support this program or this hospital to continue. And the only thing is, our challenge is our bishop maybe have no power to help us accordingly. We are working under CDTY. I don't know what I can say there. I give much thanks to him also because he is helping us. He have opened this hospital, and a lot of things are coming in, like the theater, which was not there, the maternity working, the scanning, those who are working with burns. There is a doctor that I've seen.
Dr. Laurel.
Yeah.
Yeah.
So I think the hospital is developing.
Yeah.
And I hope it could continue. Okay, for me personally,
Yes.
as working in the hospital here, what I would like to say is, can I not go for TB training somewhere
Yeah.
to increase my knowledge? That is my question. Because I've been for training, some trainings of 5 days. 5 days, my experience is just from that. And as a practical working, that's why I'm working perfect. I'm treating TB exactly. And the whole South Sudan knows about me.
Yeah.
Yeah.
That's amazing.
Because I'm giving a report to the government even.
They know that you're the in charge for this.
Yes.
A pretty extensive program. So that means a lot of people come here.
Yes.
From the whole country.
Yeah.
Okay.
Most of people, they come special patient. I am not even treating only South Sudan. I'm treating sometimes Central Africa, Congo are coming to me.
Yeah.
Yeah. And we are treating them. They become cured and they go back.
Oh, wow.
But
That's amazing.
Yes.
That's so incredible.
So why can I not to be trained further?
Yeah.
especially for multi-drug resistant TB, which is very new in this facility.
We were just talking with antibiotic resistance. Tuberculosis affected too. There's resistant bugs, including TB, and that's very scary if we don't have the drugs to treat TB. Multi-drug resistance is a problem. So you're right. Some sort of investment in training you further.
Yeah, this is my question to me. I am questioning myself that can I not to go for certain training, at least to increase this knowledge of TB, because I cannot to go.
You said you were becoming old.
Yes, maybe I'm just stuck in TB. I don't know because they don't want even to move me from TB. Then why can't nobody can help me to train me at least?
There's trainings for all sorts of things. So TB is a very good idea since we have this program. Maybe that's something I can bring up with Benson and talk to him about something. Maybe that's something nobody really thought about, but give some investment. They give it to like midwives and nurses. Maybe that's a good idea to invest in some training.
Okay. I've not been sent from this program here to go for training,
Yeah.
TB
Yeah.
training. And still we are dealing with leprosy.
Leprosy?
Leprosy.
Yeah.
We are also working with leprosy.
How many leprosy patients do you see?
Now, due to lack of awareness, we have more than 12 patients for this year.
There could be more in the community. They don't come for
If you
treatment.
come to my department, you will see the files that we were dealing with leprosy patients in the whole Western Equatoria state. There are very many files from Tombora, Najero, up to Maridi, with all the units, all the patients who are there. Now we don't know where they are. Because of the civil war, security, everything stopped. TB is abandoned, leprosy. Leprosy is abandoned completely, and there are patients. I don't know, this disease, the two diseases, they are difficult disease and they are chronic, as you know. The two diseases are difficult to treat if you are not very close with the patient. If you don't monitor them, they will just die. They were being helped because the sisters took leprosy and TB. I don't know how now the program is going about it. I'm very happy with the AAA. TB could be stopped from here. I thank God AAA is in. They are helping. They are supporting us with the drugs, with some motivations, with some what we are lacking. This is what they are now helping us with, like some pens, whatever we can work with, like tools. AAA, but not leprosy. They have exploded leprosy now, and leprosy is a problem. We should do, who could take us for this training of leprosy and the TB? They abandoned the disease. When a person is coughing, the person is being abandoned even by the relatives. Same for TB, leprosy. So this disease is maybe, in the Bible it was healed by God. The man who had the Naaman, I think you know him. You heard of him. Naaman had the leprosy, but nobody wanted to greet him, even to be near with him. And he was healed by Jesus, by God. I am just crying to God, asking him, praying to him to give us somebody who can help these people, the two diseases in Western Equatorial State. What can we do? The two diseases is abandoned. People doesn't want it.
The stigma is huge. They stay away and they So this is very psychologically damaging to have a disease that is physically killing you and even nobody cares anymore.
Yeah, that is it.
Yeah.
So the most important thing is I'm requesting is how can I not to go for training? To be trained about TB, leprosy.
So you can help. Somebody's singing. No, you're right.
Mm.
Philomena, you're so right.
Mm.
Since you've been doing this basically by yourself for so many years, dedicating yourself, it's always good. You keep increasing knowledge. Medical knowledge is something that should always be improved upon. And we should all continue our medical education. So,
This is the most important thing. And in this hospital, you have a problem with this hospital sister. The issue of drugs, tools to the hospital, generally. It is a problem for us to get drugs. You are admitting now at least we can see some drugs coming.
yeah.
So we are praying to God. Maybe it should be more than this because we have a lot of people even from Yambio, from other counties coming to Nzara. So we need drugs and the equipments and instruments. Like for TB, if we can enter that ward, we have a very old mattress there, very old one. And this is not supposed to be in the middle of the community like that. We should be at least aside. Who is going to build for us the ward? It is a problem still for us.
Yeah.
Yeah, and now the patients inside, to admit one, is having a problem also. The beds, if you are admitted and you are very sick, you want to be comfortable. Even if seeing yourself comfortable in bed, you will know that you are going to be cured. But if there is problem, you don't sleep very well. That is another thing. So our TB department is not yet okay in Santa Teresa.
So there's many improvements and expansions, but there's still a lot that we need. We need better beds. We need more trainings. We need more equipment, more medications. And this is all donor funded. And we need to use our resources.
Yeah. We need the resources. We need a lot. This hospital needs a lot of things. It is still.
Oh yeah. Still a long
even
way
we
to
need
go.
training.
Yeah.
If we can have a training center in Zara, why not? Training center in Zara.
Yeah.
Sister Laura was planning, but failed. She was planning that we should have a training center here, like the one in Yambio, in Wau, in other places. Why not in Zara? Because this hospital is becoming bigger and bigger.
Yeah.
The bishop is bringing people some other diseases which we even when it's like the one now we transferred to Juba. This fetus, the baby.
Yeah.
What do we do with that type?
Yeah.
This is what we are receiving here. A lot of things.
Oh yes. Since I've been here, we've seen very many tough and rare cases. We see everything because we have so many referrals from around even other countries too.
Yeah, around and the other countries like Congo, Central Africa, even Khartoum.
Yeah.
Yeah. And even me now, I'm receiving TB from Juba. You see?
Yeah.
I have 2 patients transferred in, self-transfer in from Juba.
Oh, they heard of you all the way from the capital.
Maybe they heard of Nzara.
Yeah.
Because Nzara has been a TB center for long.
Yeah.
Since in 1994.
Wow.
TB program started in Zara.
That's 30 years of treating tuberculosis for the whole country.
Leprosy and the TB started in that year,
So
1994.
we definitely need support because we treat so many people here.
We treat so many people, even some our neighbors comes to us. This hospital is now very big. I'm speaking generally, including TB. Capacity building, this is one. To support this hospital to grow, to grow as it is growing, we need the support. You know it very well. You have taken time here. You know what is happening. Our challenges.
It's good to keep knowing what's needed so that we can help and see where the resources can come from and where to provide support to improve, because this hospital serves so many people. So many people depend on this hospital. That growth is helpful. Resources are helpful because it's life-saving. For any final remarks about yourself, your life, anything?
I've nothing to say, but I thank you very much. I think you are the first person who have taken all my history from home up to the hospital. I thank you very much for that. And I hope we are going to come back with some achievement.
Oh, yes. I thank you for the time you spent to take the time out to welcome me, explain to me, and make me understand, and make everyone who's listening to know you a little bit better and get to know this area better. And so change can only happen with understanding. And you have so much to give and offer. You've done so much in this world, and we should all be inspired by you. I am. So I thank you very much, Philomena.
Thank you very much, sister. Thank you very much, really. Thank you. I thank you very much. I hope you are going to do something for us, especially for me personal, as you called me.
Yes.
Yeah.
Yes, I will do whatever I'm able to do.
Yes.
Whatever God allows me to
home,
do.
Thank you very much. Thank you.
Thank you.
Bye.